So why is this book important? Well, over the many decades in my work as a registered nurse, mental health social worker, adult educator and spiritual wellbeing coordinator, I've learned that people generally want meaningful connections and flourish and grow. The elders of the meditation group also want connections with meaningful engagement, and they want a safe space, and many want to learn to live with more silence and calm, and being mindful helps them in this. Older people say that gratitude helps them along the way to hold the multiple losses of life they face in a more balanced way. In my research, the group was a mixed group of elders, some very religious and some not religious at all, and they all responded in a very similar way to the gift of gratitude and learning to be in the present moment. The meditation practice has actually universal quality, speaking to the more religious through the wisdom of the psalm, calling us to be still and know that I am God. Dot, a more articulate 95-year-old, in the research really emphasised how important it is to have and engage in an aged care setting a space for the spiritual part of themselves to grow. And as Dot said, to prepare ourselves also for our final letting go, our last transition in life. Beate, one of the residents who had attended the group for a number of years, also emphasised the importance of meditation being a way of helping us to learn to come home to ourselves. She said, we spend all our life running around being active and doing things and creating an external home, but often have neglected to develop our internal home. In the 6-week program, I dedicated week 4 to this. The topic is called Connecting to Mind and Body and Learning Being at Home in Yourselves. So why is this book important? Because the words are coming from the frail elders of the group themselves, speaking to us with their lived experience. The meditation group has been evaluated and developed with feedback from the elders. Unfortunately, we don't have much qualitative evidence from people living in aged care. And I told the 13 elders in my research that other people would be able to hear what they have to say, and it would become public, of course, in an anonymous way. So they made a point of telling us their truth to us.